Hello everyone, I'm Dr. Saurabh Dikshit. I'm your surgery faculty. So today I have come to my channel just to address you during the last 24 hours that are left for your exams. So many of you must be tense, many of you must be nervous, many of you must be excited. Lot of students are texting sir what to do, how to tackle this examination tension. So let me tell you, already the time has gone. Whatever you have done, just trust yourself, you have done your best. We have taught you the best, just hope for the best. Remember the examination, this is only one single exam. You will have a lot of hurdles in your life which you will have to pass. So whatever be the result, it is always going to be in your favor. Just pray that yes, you are able to concentrate yourself during these 3 hours or 3.5 hours basically. When we talk about concentration, we mean that give your best. Don't think that okay, 10 questions were tough, 20 questions were random, 20 questions were like I have never heard of them. So it's a competition between your caliber people. It is not a competition with the faculties or with the teachers or with the, you can say, legends. So it's basically the competition amongst yourself, and that is why you should hold your nerves, you should hold your patience and do your best. So don't think whatever that you have done that is not sufficient and this and that. We have to have 100% confidence in our preparation. Without wasting a lot of time, I've just come here to just give you a last moment chit chat on the most common and some miscellaneous stuff of the surgery. So let us quickly discuss certain most common. So when we talk about the head and neck, so when we talk about the head and neck, let us talk about some most commons. These are very important for you. So oral cancers. So the first topic that I would be discussing will be oral cancers. So what are the most common things? Most common site for oral cancer, you know, today I'm going to discuss only the most common. Generally, I don't discuss a lot of most common, so I will be just discussing this part. So most common site for oral cancer, answer is the tongue. And what tongue that you talk about, what part? It is the lateral two-third, lateral two-third. Then most common site when we talk about India, what is that? In India we enjoy Kamla Pasan, yeah, Vimal Dane Dane Mein Kesar and blah blah blah, lot of things. So what we do, we stuff it around the buccal cavity. So it is the buccal cavity or gingivo buccal complex in certain cases. This is again very simple. Then most common type of oral malignancy that we have, answer is SCC. This is again very important. Most common type is SCC. Then when we talk about the prognosis, again you need to understand tumor with best prognosis and tumor with worst prognosis. So best prognosis when we talk about in oral cavity, it is CA hard palate. This is again very important. CA hard palate. The next is the worst prognosis. The worst prognosis that we talk about is gingivo-buccal complex. So it has the maximum risk of metastatic spread. So it is the buccal cancer. It is the buccal cavity cancers which are having the worst, you can say, prognosis. The most important prognostic factor, this is again very important. So most important prognostic factor, what is that? Answer is the lymph node status. So lymph node status greater than the depth of the tumor. This is again very important. So these are certain most important things that we need to understand and remember in oral cancers. Then from oral cancers, let us go to the salivary glands. Remember students, I'm not going to teach anything today. I'm just going to revise the most commons. So when we talk about the salivary glands, you need to understand that the most common tumor overall, so the most common tumor overall, answer is pleomorphic adenoma. So pleomorphic adenoma, that is what is PMA. So pleomorphic adenoma is the most common tumor overall. The next very important thing is the most common benign tumor of the salivary glands, the most common tumor of the parotids. So answer for all of them, answer is pleomorphic adenoma, that is PLA. This is again very simple. Then most common malignancy, this is again very important overall. Again, most common malignancy in adults, most common malignancy in infancy, most common malignancy post radiation, most common malignancy you can say with smokers, the answer for all of them is mucoepidermoid cancer. So mucoepidermoid cancer. This is again very simple thing. Now when we talk about infancy, and when we talk about salivary gland tumors in infancy, there may be two things. What is that? If you get a question most common tumor, the answer will be hemangioma. This is what is very important. Or most common solid tumor, now the answer shall be pleomorphic adenoma. Most common malignancy, the answer will be mucoepidermoid carcinoma. So remember all these things, these are very important. Most common benign tumor associated with smoking, the answer will be you have to understand that's a Warthin's tumor. So that's a Warthin's tumor. This is again very simple, Let us move forward and let us go to the next section. So next section we go to the thyroid. So head and neck we are moving to thyroid. When we talk about thyroid, again you need to understand most common thyroiditis in kids. So when we talk about kids, it is acute suppurative. This is what is very simple. Most common thyroiditis associated with IgG4 disorders. What is the answer, students? Answer is Riedel's thyroiditis. This is what is again very important. Most common thyroiditis associated with Turner syndrome, associated with Down syndrome. What is the answer, students? It is Hashimoto's. Most common thyroiditis associated with pregnancy. Now the answer will be DeQuervain. So DeQuervain, and you can say most common thyroiditis associated with viral infections. This is again the DeQuervain. So DeQuervain is the answer for both of them. Next is, let us talk about something about the thyroid, you can say tumors. So CA thyroid, carcinoma thyroid, again certain most commons here. So the most common type overall, the most common type associated with radiation, the most common type in infancy. So most common type overall, most common type associated with infancy, most common type associated with radiation, most common type in iodine sufficient areas, most common type associated with lymphocytic thyroiditis. Again the answer is the papillary. So lymphocytic thyroiditis. Now earlier many people, even I used to teach that it is lymphoma, but it is clear, absolutely clear that it is nothing but papillary cancer thyroid, papillary CA thyroid. Next is the most common type associated with goiter, long standing goiter. Remember this is again very important. Most common type associated with iodine deficiency, most common type associated with pulsatile bone mets. So the answer for all of them is, what is that? Answer is follicular CA. So follicular CA thyroid. The most common type associated with pheochromocytoma, the most common type associated with Cushing's, the most common type associated with amyloidosis, the most common type associated with diarrhea. So all of them, the answer is 1 and 1, that is MTC. So these are certain most commons that you need to understand in this also. Now let us go to the cancer of the breast. So from head and neck, now we are going to breast. So from head and neck, now we go to breast. In breast, there are a lot of things. First we'll talk about the cancers. So when we talk about the incidence, the most common type, answer is on the basis of epidemiology. So on the basis of epidemiology, it is sporadic type. On the basis of pathology, On the basis of pathology, it is invasive ductal NOS, invasive ductal NOS, not otherwise specified. On the basis of location, students, on the basis of location, answer is, you know that it is the upper outer quadrant. So upper outer quadrant. This is again very simple thing, and you should know 55 to 60%. And the least common, this is least common. And what is least common, students? 5 to 6% is seen in inner lower quadrant. So inner lower quadrant. Next is, when we talk about the prognosis, again the best prognosis, the worst prognosis. The best prognosis is associated with, answer is invasive tubular CA. So invasive tubular CA, I am talking about the cancers. The worst prognosis is associated with, what is the answer, students? Answer is inflammatory carcinoma. So inflammatory carcinoma, many a time word inflammatory carcinoma is not there, and they play with this and they say lactating carcinoma. So lactating carcinoma or inflammatory carcinoma, this is again very important. Or this is also referred as cancer and mastitis. So sometimes mastitis mimicking cancer, this is what. Better than, next is the metaplastic cancer. Metaplastic cancer. Again, let us talk about certain important things when we are talking about CA breast. Let us talk about the most common, when we talk about the spread. So most common site of spread and route of spread. So most common route of spread, you know, answer is lymphatics, and most common site of spread, the answer is axilla. Now when we are talking about similar spread, and when we discuss the most common distant mets, so distant mets, you know, it's always hematogenous. And when we talk about this site of spread, this is very important. The site of spread will be your bones greater than lungs, liver and brain. Now when we talk about the bone metastasis, what kind of bone metastasis? They are osteolytic also and osteoblastic also. So osteolytic better than osteoblastic as the answer. When we talk about the sites in the bones, it is lumbar vertebra, this is point number 1, better than femur. Then thoracic vertebra, we have thoracic vertebra, then you have ribs, and then you have the skull. This is what is the order. Now when we talk about MRM, there are 2-3 one-liners which are asked from MRM also. MRM, when we talk about the most common early complication, so the most common early complication of this, answer is seroma. This is again very important. So most common early complication is seroma. Most distressing complication, last year NEET's question. So most distressing complication, answer is, it is the limb edema due to lymphatic obstruction. So answer is limb edema. Next is most dangerous complication, answer is angiosarcoma, and this is also known as Stewart-Treves syndrome. Angiosarcoma, and this is known as Stewart-Treves syndrome. What else, students, you should be knowing? The most common nerve injury during MRM, the same is most common nerve injury during axillary lymph node dissection. You know, students, during mastectomy we don't damage. It is during the axillary dissection that the intercostobrachial nerves that are traversing through the axilla, they are damaged. So second, intercostobrachial nerve. This is what is very important. So with this we finish the breast also. The next is, when we talk about the next unit, let us go to the liver. So when we talk about the liver, you also get lot of questions on the liver also. The most common, so I am talking about the liver tumors. The most common tumor of the liver, most common benign tumor, most common benign tumor of the liver, the answer for both of them is hemangioma. This is again very important. Next is most common liver tumor associated with diabetes mellitus type 2 or type 1 also. Diabetes mellitus you can say. Most common type associated with glycogen storage disorder, and the most common liver tumor associated with the fat accumulation. Yeah, what are the answers for this? And OCPs also, the answer for this is hepatic adenoma. So hepatic adenoma. So hepatic adenoma. So we have FNH, we have hepatic adenomas, and we have hemangiomas. So adenomas can convert into the hepatocellular carcinoma also over the time. When we talk about hepatocellular cancer, HCC, certain most common things that you need to understand. The most common cause for this answer is hepatitis. So hepatitis is the most common cause. Again, most common cirrhosis associated with this answer is very simple. It is alcoholic cirrhosis or alcohol liver disease. Alcohol greater than autoimmune.